When you have an infection, which then spreads to the rest of the body, we call that sepsis. Sepsis involves about 40 million people on this planet every year, 40 million, of which about 10 million die. So we're talking about one of the most important diseases of humanity.
Yeah.
And the standard treatment is to give antibiotics, and that's it. So what happened, this goes back to 2016, I had a patient in the ICU who was dying. And so, you know, as a physician, you want to do whatever you can to help that patient. That's what we're meant to do.
Yeah.
That's what we're trained to do. That's what my South African training has led me to do. You can't just say, okay, she's going to die. You say, well, what can I do to help this patient? So I had previously read a paper by Dr. Fowler on the use of vitamin C for sepsis. And I thought, you know what? I'm going to try it. What do I have to lose?
Right.
What do I have to lose? This is a safe medication.
It's vitamin C. I mean,
she's going to die. Let me give it to her. So I read his paper. I contacted the pharmacy. We gave this patient intravenous vitamin C. My expectation is she wouldn't survive. When I came back the next morning, I was completely dumbstruck because she was in multi-organ failure. She was on a ventilator in renal failure. The next morning, she was off drugs that support her blood pressure. We got her off the ventilator. Her kidney function had improved. And this lady, who would have died, there's no question, walked out of the ICU 3 days later.
No way.
So I said to you, like what you just said, no way. How's that possible? So, you know, when you have an experience like that, you say, wow, that's pretty cool. I'm going to do it again.
Yep.
And I did it again, and I did it again. And I did it again, and we saw the same effect. And then, you know what, our nurses noticed, hey, you know what? And you know, the nurses are the patient's advocates. They're there to do the best for the patient. If the nurse knows something is true, they're going to tell you. And the nurses were telling me, hey, what's going on here? These patients are getting out of presses early.
So they were so used to seeing these people dying that it just became obvious, like, what's going on? All of a sudden, people aren't dying of sepsis anymore. Something that we're having to carry their bodies out of here. We're not carrying their bodies out anymore. What's going on?
Yeah, so the nurses were my strongest advocates because they were looking after the patient. They could see this dramatic change. Our use of renal replacement therapy for people in renal failure decreased. So the nurses thought this was astonishing. So what I was actually going to do is a randomized study in which I would randomize some patients to vitamin C and some to placebo. The nurses said, no. We object. You can't do that. How can you give a patient a placebo when you actually have a treatment that can save their life?
They literally were like, it would be unethical for us to basically kill people to prove that this is working because we're so sure that it's working. Now, to be clear, was it just vitamin C by itself, or was there a protocol that...
Yes, that's a good question. So what I did is I combined the vitamin C with thiamine. I chose thiamine for various reasons, which may not have been valid then, but actually seems just by coincidence to be a good choice, because you need thiamine for energy metabolism. Thiamine is involved in your mitochondria and making energy, and many patients are thiamine deficient. I had added the thiamine for another reason, but it was just fortuitous that it was a good choice. And I added corticosteroids because there's synergistic action between corticosteroids and vitamin C. In fact, subsequently, after we did the study, which I'll tell you about, we actually went to the lab at ODU, and we actually proved in the lab, in a lab model, that vitamin C and corticosteroids were synergistic in protecting cells against bacterial toxins.
Wow. All right. So in this situation, you're not attacked by the hospital. The hospital's pretty excited about it. We have a video discussing this massive success and your discovery. Folks, look at how this was treated in the immediate moment where the hospital recognizes, oh my God, we have a hero here. This is incredible. Take a look at this.
Her daughter found her in the bed, unresponsive, and she called the ambulance, and that's when she went in.
We had a young woman who was dying from overwhelming sepsis.
She just had all kind of machines and tubes going.
Maxed out on several pressors.
This was a woman who was certainly going to die.
Tunnel dialysis.
So what Dr. Merrick has done is taken 3 readily available agents, steroid, glucocorticoid, vitamin C and thiamine and put them together in a special combination.
A very simple yet elegant research protocol,
We gave it to the patient.
and it worked.
We thought it had to be a fluke. But then we started having patient after patient after patient that just had these remarkable results. They would be at death's door, and 12 hours later, they would be like 50% better. We literally have seen patients walk out of here we did not think would leave.
Sepsis is a devastating disease, and over 250,000 patients a year die in the United States, and it's estimated over 8 million worldwide.
The incidence is increasing. So obviously it's an important disease. This combination of therapy appears to cure severe sepsis and septic shock.
My lab, my team and I were delighted to confirm his findings. We tried vitamin C alone, nothing happened. We tried hydrocortisone alone, and nothing happened. And we put them together, and it completely restored the barrier function of the cells. I have been working in the field of endothelial cell biology for 30 years, and this is the first time that we see a treatment that works both in the clinic and in the lab.
And obviously his sepsis is under control.
The accomplishments were quite inspiring. Significant decrease in the length of stay, significant improvement in reducing the mortality of those patients.
Well, this data is preliminary data. It's not been subject to a randomized controlled study. And yet here at Norfolk General, it was deemed to be so effective with such little side effect that it was unethical not to offer this to patients here.
We think it's extremely safe with really no adverse effects, and it has the potential to save thousands of lives.
Whatever you did, it worked, because my baby's still here.
So, Paul, when we talk about this protocol, there's a lot of people, as we know, one of the leading cause, if not the leading cause of death in hospitals. So for people who have a loved one that maybe are being rushed in the hospital, they find out that it is sepsis, and they want to recommend to the doctor, what is the actual protocol that they need to know?
Yeah, so it's actually not complicated. I think the most important concept is early treatment.
Okay.
Because as we said, sepsis is very time sensitive, and you don't want to delay. So what we recommend is that you start immediately in the ED, emergency department. So if you think a patient is septic and you're going to give them antibiotics, then I would start them on the protocol. And if it turns out that they don't have sepsis, well, you've lost nothing. But if you've missed it, you've missed that window of opportunity.
Okay.
And I think that's really the message for doctors, is that this is time sensitive. You don't need to do a whole host of special tests. So what you need to do is treat them early. And vitamin C is very simple to give. The pharmacy can prepare it very simply.
So what are the dosages?
Yeah, so what you want to do is the vitamin C is the most important out of the whole cocktail, and you want to start this early. So the dose is 1.5 grams of vitamin C. It has to be given intravenously in a little mini bag, infused over 20 minutes.
Okay.
And so that they can start that in the emergency department, or they can start that immediately in the ICU.
Now, is that something every hospital has in its, is that around? Like if I ask for vitamin C, the hospital has that?
There's no reason that a hospital shouldn't have intravenous vitamin C. It used to be used for intravenous nutrition, but now it's quite commonly used, and there's no reason a hospital can't get hold of intravenous vitamin C and have it on their formulary.
Okay.
And so they should have it available. They should have it in the emergency department. So it's timely administration is really important. One of the unanswered questions is that if treatment is delayed, do you need a higher dose? And that question I really can't answer. We need to do more studies. But what I can tell you is that if patients come in early and they treat it early when they come to the emergency department, 1.5 grams every 6 hours is what works. And then we combine that with thiamine, 200 milligrams intravenously every 12 hours. And the thiamine, I originally added it because I thought it would limit so-called toxicity of vitamin C, but that was somewhat erroneous, and thiamine is very good for sepsis.
Okay.
And then the third piece is hydrocortisone. This is a corticosteroid, which is often used for sepsis. It downregulates the inflammation. It works very well with vitamin C, and so the dose is 50 milligrams every 6 hours. So this is not a complicated protocol.
Okay.
So, together with antibiotics. So, you give early antibiotics, which is the key to treatment, together with early institution of this protocol. And, I think it's not complicated. It's very safe. It's easy to administer. And, it should become more widely available. Because, as we said, sepsis is a deadly disease. And you want to do what you can as quickly as you can. And why wait for the disease to progress? Rather treat it early before it's progressed.